Hi, everyone. Doug Jenkins with the Findlay-Hancock County Chamber of Commerce, and certainly a lot of changing scenarios with COVID-19 and coronavirus and how everybody is adapting to that. I've got Todd James from the Red Cross with me today, and the reason we're talking about that, Todd, is with the schools shut down. I saw a lot of people on my Facebook feed volunteering their high school age kids to do some babysitting so people can still go to work, which is good in theory, but we want to make sure that that's being done safe, and that's why we bring the Red Cross in.
Thank you, Doug. And you're absolutely right. I think it's it is a great idea if kids can help other families by providing some childcare services if they've had the right training and feel comfortable doing it. We've got a great training course, our babysitter training, that prepares 11-year-olds and up for being able to offer good childcare to families who need it. But it is important, I think, that they have that training. Now, right now, with situations the way they are, it may not be a class coming up where you can sign your youth up for one of the classroom settings. We have a online babysitter training basics course that anyone can access, take at their own pace. There's also an advanced babysitting course that you can take online, and I would highly recommend anyone 11 or older who's looking at doing childcare, getting into it now with a big need for it coming up in the community. It doesn't take a whole lot of time, and it's definitely not just for the children that you'll be caring for and their families, for their safety and their peace of mind, but for your own safety and your own peace of mind also.
No, absolutely. You mentioned that's online. Just go to redcross.org for that information.
Go to redcross.org/take a class, and then you'll have an option to look for the different kind of things you want to put in base training, and it'll pop right up there for you.
All right. Along with that, certainly not going to be doing any CPR training courses in person right now, but you can get that information not just online, but also the Red Cross app is very good for this too.
Yeah, we have we have an app for everything, as they say, and there is a first aid and CPR app, and it also has a list of classes that you're able to take. So you can find the information there. You can give us a call here at our office, and we can direct you to it. But the training is great. It's going to teach childcare basics. It's going to teach the youth who are taking the course, and even for adults, if you've never babysat before, it's been a very long time. What a great refresher course. Going to cover the safety things that you need to look for as you go into a household and taking care of children, tips and ideas and activities to do with the kids. And these are things that every child care provider should know. But now we also want to make sure that beyond those basics, that everybody who might be doing some childcare also do need to practice the safety tips that we're putting out there for everybody in the public when we talk about the COVID-19 virus and limiting exposure to that.
Well, let's talk a little bit about that. As of the recording of this video, daycare centers are still open in Ohio. I would imagine just not only from a COVID standpoint, but also from a standpoint of maybe having some kids who have not done a lot of babysitting before. You don't want to be putting too many kids under the control of one high school kid right now, especially if they don't have a lot of babysitting experience.
Yeah, I think you really do have to take a common sense approach to it, of how many children can one person oversee at a given time, and a lot of that depends on their age, maturity level, activity level. But really, the babysitter themselves needs to feel comfortable in a situation, and that's one of the things with the online babysitter training course, or if you take the in-person course, is we're preparing these babysitters that they're running their own business when it gets right down to it, and so a lot of it is good decision making. We talk about making sure that you're walking into a situation where you feel comfortable. You've established some rules up front with the family. What are the ground rules that they have for their children, and what do you expect? That you have great or good contact information for the family members, for emergency numbers, and that you feel comfortable going into the situation, that you can handle that situation, that you've got the appropriate number of children in the situation, that you feel comfortable that they're at an age where you can care for them, you can do the activities with them that are expected, and that will let them have a good experience with you as a babysitter, as a child care provider. And so that's a lot of what we talk about when we do this training, as well as showing the basics of even down to, how do you spoon feed an infant, and some basic first aid and safety tips, and having a checklist that you want to make sure you run through before you start your child care service. So we're going to cover all of that in the training.
All right. So hopefully, for people who still have to go to work, and if they are leaving their kids with high school kids, or maybe even middle school kids who are home from school due to the schools being closed, that's a good resource to have for you. Todd, I do want to touch on one other thing though here before we let you go. Certainly, the Red Cross, most known for its blood drives. I imagine coordinating those right now is quite the issue. In terms of blood supplies, in terms of people who want to donate blood right now, how can they help?
Doug, you're absolutely right. And right now, we need folks to donate blood. Our blood drives, our blood donations are a safe place. And we are taking extra steps to make sure that everybody involved, our donors, our volunteers, our staff, follow proper protocols. We'll be checking everybody's temperature before you even come into the drive. We'll be doing health screenings. We're making sure that we have hand sanitizer available for everybody, wiping down the surfaces. And we need folks to give blood. We have to maintain a good, stable, safe blood supply. And right now, because of what's going on with the COVID-19 virus, around the country, we've had about 1,500 blood drives that have canceled at businesses and locations that have closed. And that means that's about 50,000 units of blood that patients in hospitals were counting on that right now are uncollected. So we've got to make sure that we make up for that and meet the demand at Blanchard Valley and everybody everywhere else that's counting on folks to give blood. So if you go to redcrossblood.org, you can find a blood drive nearby and make an appointment. And again, you want to make sure that you're feeling healthy. But if you're feeling in good health, make an appointment. We're going to, again, do a screening when you get there. We've made sure that we're implementing the protocols to ensure everybody's safety. But we really are counting the community to step up at this time so that we have that blood supply that we need to take care of everybody. Folks who are counting on it for surgeries, folks who have been in accidents or emergencies, cancer patients who are undergoing the treatments that use these blood products. We've got to make sure the blood is on the shelves there for them.
Just had a surgery myself. I don't believe didn't have to have any blood transfusions during that, but I mean that's Todd. Just getting into the greater discussion about the response to COVID and coronavirus. I know I keep saying and it's the same thing, but just making sure that we're hitting it by both terms that people have heard. One of the reasons that people are trying to limit this impact is because we know people are going to have surgeries during this, non-elective surgeries anyway. So lessening the curve or flattening that curve keeps the hospitals and everything open to not just people who are going to need to be treated for coronavirus, but also just the typical things that hospitals see on a day-to-day basis.
Yeah, we're all making certain sacrifices. We all have to be flexible in the way things are operating day to day right now than what we're used to. The whole idea is to keep as many people safe as possible, hopefully lessen the spread and the impact of the virus. But again, as you said, also, it's not just folks who might be affected by COVID that would need the hospitals, but every day we still have a lot of people who are counting on the doctors and the nurses and the blood supply and the hospitals and doctors' facilities to be there for them. So, if we all work together, if we follow the protocols and the suggestions that are coming out there, we'll get through this. We'll do it okay. But right now, giving blood is still very safe and it is vital. So if you are in a position where you can give blood today or tomorrow or in the next couple of days, please go to redcrossblood.org or call 800-RED CROSS. You can find a drive nearby. If you haven't downloaded the blood donor app yet, you can schedule your appointment right there on your app. You even get to trace your blood's journey. So we're going to tell you when we've collected your blood, when we send it to the laboratory, when we've tested it, and when we've delivered it to the hospital where it's saving lives. And you get to see that journey every step of the way. So you know that you've saved lives and you'll know exactly when it got there and started that life-saving process. So you can download that for any platform. It's a free app, the Red Cross Blood Donor app. But we encourage you to please help us make sure that we have that safe, stable blood supply that we have to have for our local community, and understand that a lot of drives have been canceled because of the situation. Businesses that were going to hold drives that are now closed can't do that. We are going to make sure that we collect those units that would have been collected because we need them to save lives.
All right. Well, Todd James, thank you for that information. And of course, if people have questions, they can give the Red Cross a call or check them out on their Facebook page and various social media as well. As far as the Chamber of Commerce goes, we're in the same fluid situation that everybody else is right now. We're going to be providing you with information for your businesses throughout the week with the best information that we have on how you can find safe and secure ways to continue to maintain business, whether it be working from home or how you can safely be in the office for as long as that possibly can go. So we'll keep you up to date with the latest information. I'm Doug Jenkins with the Findlay Hancock County Chamber of Commerce.